Hi, everybody. Welcome back. I'm Michael Quirke. I'm a licensed therapist, and I want to talk with you more today about complex PTSD or CPTSD, as it's commonly referred to. Now, before we dive in, remember this video is for your educational and informational purposes only. I'm a therapist. I am not your therapist, and I am not providing any diagnostic or mental health treatment in this video. So let's dive in. If we already have a condition called post-traumatic stress disorder, PTSD, what is the need to have something else, another condition called complex post-traumatic stress disorder or CPTSD? Isn't trauma complex anyway by default? Now, this is a great and much needed question because the answers to it can make a world of difference if you are a complex trauma survivor. While PTSD and CPTSD inevitably have some overlap, and when it comes to both the symptoms and the outcomes, there are major differences in how they come to be. And those distinctions can be summed up in terms of the quantity and the duration of the symptoms. An ideal starting point, if you would like to better understand complex trauma, is to learn how to identify its symptoms. Now, I've spent over 25 years now treating complex trauma, and it's been most of my clinical work. So, what are the 17 symptoms of complex trauma that I see pretty much every day? The first one is probably flashbacks. Yes, this is a classic symptom of any type of trauma, but with complex trauma, there are way more memories that return as intrusive thoughts or intrusive images. CPTSD flashbacks are distinct in that they're often more what I call emotional flashbacks. They're not like what you see in the movies. The next sign, number two, is memory lapses of different kinds. Now, when traumatic memories are showing up as flashbacks or nightmares, they can often also be buried underneath a layer of fear and disconnection. Rather than rather than risk reliving your pain, complex trauma survivors often struggle with memory lapses. In a sense, on a day-to-day level, we'll often say compartmentalize or block out or just move on from painful experiences. So if your trauma occurred early in life, before you had the ability to lay down what we call explicit memories, we tend to not have that ability to about 5 or 6 years old. Before that, there's very few explicit memories for most people. Then it's very common to have no memory and just a kind of sensory flashback or an emotional flashback or what is often referred to as an implicit memory, a somatic flashback, the feeling of how it used to be. Number three is a distorted sense of self. Chronic trauma, especially trauma that occurs during childhood, can make you lose touch with who you are. It can make you confused about your identity. That's because you were in survival mode for so long that it feels tricky to connect with your deepest needs, wants, beliefs, and values. That's something that I hear from many of the men and women that I work with. They will say things along the theme of they don't know who they are. They were so busy focused on other people's thoughts, beliefs, ideas, visions that they just absorbed them and they never really reflected on them and questioned how much of a fit they were for them. Number four is that you probably have an inability to control your emotions. You lack emotional regulation skills, or if you have them, they're weak or undependable. So when everything feels like a threat to you or a trigger, staying calm might rarely be an option for you. Emotional dysregulation is a key symptom of CPTSD. Another key symptom is number five, hyperarousal. Your sympathetic nervous system is dominant. It's firing all the time. You're getting wound up, revved up, keyed up. You feel highly stressed out. After being on high alert for so many years, the human mind and body can't usually just flip a switch and return to calmness and balance and equilibrium. Thus, your high stress response can be your default setting. That's the case with many of the people that I work with. Number six is that you're dealing with unexplained headaches. Now, while this connection is not always fully understood by people, right? We do know that tension in the neck and shoulders, those stress responses play an important role. Either way, unexplained headaches are a known red flag for trauma, and they are common with people who struggle with what we call dissociative symptoms. Number seven, you may have unexplained GI problems and a chronic upset stomach. That's because the presence of high levels of stress hormones over time, when I'm talking about things like cortisol, um, they contribute to a wide range of gut issues. And probably, I don't know, 80% of the people in my practice struggle with chronic GI problems. Next, we move on to number eight, sleep disturbances. These are ubiquitous. Anyone dealing with nightmares, dealing with the hyperarousal I just talked about, is likely to experience problems getting a good night's sleep. Struggles with sleep onset, with sleep depth, with sleep duration tend to be the norm in the men and the women that I work with. Also common is number nine, autoimmune conditions. Stress is a major player in the suppression of our immune function. CPTSD ramps up your stress, and in turn, it increases the likelihood that you're going to be facing down immunity related problems. Number 10 is that you're dealing with a chronic health condition of some kind. CPTSD is often associated with chronic pain syndromes, with high blood pressure, with heart disease, with metabolic syndrome, and more. Don't shrug off the possible connection to medical problems that you might be facing. Number 11 is that you avoid certain circumstances, places, or people. Avoidance in CPTSD is a key symptom, and it's actually something that maintains the disorder. And rather than risk being triggered, if you've got CPTSD, you might find that you go to extremes to avoid anything that reminds you of some of the traumatic experiences or relationships or circumstances that you have been through. Number 12 is very common, and frankly, seems to be getting more and more common every single day. And that's substance use and dependence. Self-medication sometimes feels like the only way to numb your pain. Of course, it's only going to add to and escalate virtually every single symptom that I've talked about so far today. Next is number 13, depersonalization and derealization. They're kind of like other forms of self-numbing that occur when your mind seems to detach from present moment awareness. And it can be like you're suddenly watching someone else struggle. Clients describe to me often that they will feel like they're somehow living in a dream, or one gentleman that I work with describes it as if a drug suddenly kicks in and things just start to feel off and strange and kind of fake to him. That's the derealization setting in. Or he also describes looking in a mirror and feeling as if he's somehow not real. He can see the image there. He certainly recognizes himself, but it just doesn't quite feel like who he is. Next, number 14. Again, this is a key symptom. It is challenging interpersonal relationships. Now, long term trauma can make it very difficult or impossible to trust other people fully. It can make it very hard to be vulnerable. It can make it hard to be open about who you are, how you feel, and what you want. And it can make it impossible to be vulnerable and share your emotions. Without these components, think about it, your relationships are going to be very challenging. Many of the men and women I work with who have CPTSD avoid relationships completely, or they have relationships that contain a lot of emotional, sexual, and intimate avoidance. Number 15 is low self esteem. Most people with CPTSD struggle with chronic shame, although it's very commonly unrecognized by them too. We human beings, shame and humiliation are so painful that we human beings are ingenious at our ways to deflect and distract and not recognize the shame that we feel. All the symptoms that I've talked about can go a long way towards shattering your self confidence, towards blowing your self worth. Complex trauma can make you feel like you're broken, like you're damaged, or that you somehow deserved your abuse. That's the voice of shame. Number 16 is that you have a generally negative self perception. Anybody juggling all the symptoms or many of the symptoms that I've been talking about and many of the problems that I've been describing will almost certainly have trouble viewing themselves in a positive light. And as you can imagine, sadly, this can quickly transform into some very dangerous or harmful ideas, leading us to number 17, thoughts of suicide or suicidal or self harm thoughts and behaviors. Now, you can view this as the culmination of ongoing trauma and its effects on our human psyches and on our bodies. Left unchecked, CPTSD can make you feel defeated, like you've just run out of options to heal and that you cannot recover. But that's not true. I really want you to know that if you prioritize your care, if you find the right care, it is possible to resolve complex trauma. It's possible to heal it and put your past to rest. Ending this video on the note of self-harm highlights just how crucial it is for complex trauma survivors to get the specialized help that they need. And if you are one, I implore you to do that. Now, if you want to learn more about CPTSD, please visit my website, www.michaelgquirke.com. The link is in the description nearby. On my site, I have hundreds of articles and videos there on mental health topics, and a lot of them are about trauma. Also, if you would, please like, subscribe, share your comments. I really like hearing from you. And please share this video with anybody that you think can find it helpful. Thank you so much for watching. Have a great day.